Hi, I'm Jaden Parker, and this is my presentation on the genetic disorder of schizophrenia. So, the description of schizophrenia is a brain disorder classified as psychosis, which means that it affects a person's thinking, sense of self, and perceptions, or how they see. One of the biggest signs of schizophrenia is hallucinations, whether that is vision hallucinations. They can also have auditorial and even sometimes smelling and touching sensations. But as I stated earlier, the two biggest ones are the vision and auditorial hallucination. The biggest myths on this illness, number one, is that schizophrenia means you have multiple personalities. So like the movie Split, he doesn't have schizophrenia. He has some other genetic disorder, or maybe it's not genetic, but schizophrenia does not mean that you have multiple personalities. Instead, you can have multiple voices in your head, but that does not mean you act as multiple people. Another one is that most people with schizophrenia are violent or dangerous. Most people with schizophrenia are actually passive and actually tend to get scared because of their hallucinations that they have. And usually when they're on medication, they seem just like normal people. You can't really tell they have schizophrenia. It used to be believed that schizophrenia was not genetic, instead that it was caused from bad parenting, and that people who did not have very good parents as a kid usually ended up with schizophrenia. If one of your parents have schizophrenia, you'll get it too. Although this is a genetic disorder and having a parent with schizophrenia does increase the chance, it is not guaranteed, as it is most likely a recessive gene, although it is not 100% sure. They're not 100% sure because they have not been able to fully get into the schizophrenia genetic chain. People with schizophrenia are smart. This, again, is not true. As I stated earlier, that most schizophrenics on their medications are actually just like normal people. It has not dumbed them down anymore, and while they're on the medications, they usually don't have hallucinations, so it doesn't affect their thinking. And the last one is that people with schizophrenia are at institutions or hospitals their whole lives. The only care that they really need is pills and counseling. So outside of that, they're really just living at home and doing their own thing. The causes of schizophrenia are not 100% known. Obviously, as a genetic disorder, that means that it's going to be gene mutations, although scientists are not sure which gene this is. But it could be one gene, or it could be the fixing of multiple genes of little things that cause it. Environmental factors also have a play in this, as if you get infection before birth, or if you were to have stress as a childhood. So how stated earlier, bad parenting causes it. Bad parenting does have a small chance of changing your genetics and having the chance of passing it on to your kids. What is responsible for schizophrenia, as stated, is unknown, but it is most likely the deletion of duplications of chromosome 22, I'm sorry. Because in the case study, this seems to be the number one chromosome affected with people that have schizophrenia. Is there a treatment? There is no way to get rid of schizophrenia altogether. You usually have to take treatment lifelong. Usually, even when you are not having as much hallucinations, you still need to stay on that treatment just to ensure that they won't come back. Usually, as you can see in the picture on the left, you have the support of your family and friends. You take the medicine and you have some counseling, and all this together will help you fight through the schizophrenia problems. Statistics on schizophrenia: about 1% of people worldwide are actually diagnosed with schizophrenia. The peak vulnerability is the age of 16 to 25 years old, so most people, when they get it, are not young, but instead in their teen to young adult years. In 2002, it cost about $62.7 billion of money associated with schizophrenia, showing that this genetic disorder is a big problem. which is why they're trying to find a cure for this. It's often men that develop schizophrenia slightly earlier than women. Most males, as I said, 16 to 25, while females are usually around maybe 20 to 30 in that range. Is schizophrenia lethal? So schizophrenia itself is not lethal, but for example, the HIV and AIDS virus is not lethal itself, but it can lead to something. So example, you can die from the common cold from AIDS virus, and this is kind of similar with schizophrenia in the fact that schizophrenia, the biggest risk with schizophrenia is you can see self-harming and suicide. As you can imagine, it would be hard to deal with multiple voices in your head and seeing things not really how they are in the world. As stated, suicide is the highest risk of having schizophrenia. Cancer risk is also increased with having schizophrenia. The karyotype, as I stated earlier, it is somewhere around, it has something to do with chromosome 22, although they are not sure what exactly. About 1 per 4,000 live births, there is something changed about chromosome 22, whether that's deletion or mutation. And this is actually the second most common genetic syndrome after Down syndrome, which most people do not know much people with schizophrenia or hear about it, even though it's right behind Down syndrome. This was quoted directly off the site of the study, and it says the rate of chromosome 22 Q11.2 microdeletions in the population of individuals with schizophrenia is about 80 times more frequent than in the general population. As I said, it is not sure exactly what, but something with chromosome 22 is causing schizophrenia, and it's 80 times more frequent that someone that did not have the chromosome 22 or they had some mutation. They're about 80 times more than they to get schizophrenia than one with it. This was about 1 in every 50 patients. Some interesting things you can see in schizophrenics, as we saw in class with Down syndrome, is that one of the things with schizophrenics is they often have a flattened nose and face, and they have upward standing eyes, so their eyes are a little higher and wider while their face is pretty flat. They have a single palm crease, and the short fifth finger curves inward. So as you can see here, this pinky right here is curved way in more than usual, and on the toes you can see that the big toe is quite further out than the little toe on there. Okay, so coming up here is a video that gives you a point of view on a person with schizophrenia, and I will say right now that the video is a little more extreme than what most schizophrenia people see, but it is still a good video on understanding that it's hard for them to function in the world as...
The simulation you are about to experience is a brief psychotic episode in a patient with schizophrenia. Schizophrenia can provide powerful experiences, especially for those undiagnosed.
And as she says right here, that schizophrenia without medication and like being first diagnosed is really hard to deal with.
These occurrences include sights, sounds, and even scents. If you have any discomfort during the experience, please signal your mental health instructor, Ms. McAnally. Thank you.
As you can see, schizophrenics they don't look different than most people. Although this may be an actor, you usually cannot spot a schizophrenic in the world just by their looks. And as you can see, they don't necessarily always have these visions and hallucinations. They can usually half the time just be normal functioning humans. It's once the hallucinations hit that life becomes difficult for them. Now right up here, you'll see the first hallucination starting to occur when he opens the blind, so he looks at time. And like I said, they may not be this intense, but you can still get things along those lines. As you can see here, he has multiple voices in his head, and without medication, these things can start to really affect how you deal with things.
Why are you going to pick up the phone? Stupid. Worthless. Stupid.
No, coming for you.
Something wrong.
No.
Package. Poison package.
Hang on. Never open poison.
Coming for you.
They know about
Stop it now.
Don't listen, stupid. So dumb. So dumb.
Make a wish.
As you can see, these voices are not positive in any way. They get down on the person and cause them to do
Why
bad
aren't
things.
you doing what we say? You have no friends. The TV is not your friend.
Don't listen to it. Don't listen to it. He's not real. He's not real. He's not telling you the right things to do.
No, turn the box off.
Have opportunities to develop a heroin addiction in their spare time.
Now for a quick check of the weather.
Yeah, I look like a weatherman.
He knows.
There's a slight chance of tons of rain, partly chance of you being a loser, 100% chance of you being worthless.
Now,
Oh,
obviously,
what are you doing
the
today,
TV
guy?
will not say
You gonna
this,
sit
and
there
this
with your
is
mouth open like that?
a
Coffee.
hallucination that
smart
he sees
move.
on the TV, which also
Worthless.
goes against him, along with the voices, causing a lot of
Coffee.
confusion, discomfort.
You have no friends. Waste of your time. Now getting coffee. Doing stupid. Too hot. Fire.
Don't drink poison, stupid. You are so dumb.
Don't drink that coffee. That smells awful.
Weather coming for you.
Something wrong. Please. Weather bad.
You need to stop it. Stop it with your mind.
You have to stop it.
It's the weather.
As you can see, a normal person is approaching, and although you can't tell someone has schizophrenia, you can see their interaction with other people right here and how awkward it can
Do
be.
something. Stay away from the door.
Protect us. Use your mind. Stop the weather.
No, don't answer. You are stupid to open the door.
He has to answer. Don't do it.
This is for you. Shut the door. Don't open it. Stupid to open.
You are stupid to open the door. Coming for you.
Past you now. Reaching for you. That is what I think it is.
Grab my hand. Part of the plot.
And you can see right here that the girl notices the guy staring at him, and she obviously can't hear the voices. So she is confused on why he's staring, but it's all the voices in his head making him feel worried and unsafe.
Oh, I see it came.
She knows. Know all your worthless secrets.
Coming to get you. And your secrets.
Just stop
Are you okay?
trying.
I'm
Give
worried about you.
up.
You're not acting right. We're going to get you to the hospital.
Hospital steal your secrets.
She's coming closer.
The simulation you are about. The simulation.
There is, like I said, a little bit over-exaggerated of the eyes of a schizophrenic, although it does show how their life is hard without medication and how they have these hallucinations that, will sometimes force them to do bad things. This guy felt unsafe and he did not feel secure, and he felt like everything was out there to get him, and those voices kept feeding into that thought. Some other people, the voices may say have them hurt someone, which is where the rumor that all schizophrenics are violent. Some can be violent just because of the voices. And not necessarily all of the hallucinations are bad. There are sometimes when there's kids who have schizophrenia, actually their hallucination is a best friend of theirs. They have an imaginary best friend, but to them it's not imaginary because it's in a hallucination that they see and they can't tell isn't real. And that's all for my presentation. Here's the Works Cited page, and I hope you enjoy it. Thank you for watching.